The two new agents which have been exciting news in Hodgkin lymphoma is brentuximab vedotin and PD-1 antibodies, either nivolumab or pembrolizumab. And in this trial, this was the combination of brentuximab vedotin and nivolumab as the first treatment given if patients have disease recurrence. And it was used as a treatment to get patients back into remission and then consider proceeding to an autologous stem cell transplant. Not quite chemo-free, but certainly very little in the way of chemotherapy, relatively speaking, because it's only the drug that's administered as part of the antibody-drug conjugate, not typical chemotherapy. And again, the exciting part of this combination was that it was well tolerated. I think we were still learning as to whether we could combine these two agents, and that was quite successfully done. And secondly, the response rate was high, and the number of patients that were able to go on to transplant was also high. I think a further question was just, would this combination in any way compromise the transplant process? And the study showed that that was not true, and that patients could go on, collect stem cells, and proceed to transplant without any undue difficulty. So I think the message from this trial is this combination is very promising as a first salvage treatment.
As you know, there is no one singular regimen that's used universally for relapsed Hodgkin's lymphoma. There's a variety of regimens, historically chemotherapy-based, that have been utilized. In patients who relapse after ABVD, particularly those who have short relapses, salvage chemotherapy regimens have been less successful. So utilizing novel agents in this population is a very important and clinically interesting question. And this was the first study that evaluated this clinically. So this combined brentuximab vedotin and nivolumab for 4 cycles prior to autologous stem cell transplant. And the aim in the salvage setting with relapsed Hodgkin's lymphoma remains and should remain cure. So it's important in this study that we try to maintain the curative potential, and therefore autologous stem cell transplant was included and mandated as part of the study. The overall response rates and the CR rates compare very well to salvage regimens that are used in Hodgkin's lymphoma. And from a toxicity profile, the regimen, the BV-Nivo regimen, also appears to be favorable. That in part is due to the fact that many of the side effects associated with both brentuximab vedotin and nivolumab have been cumulative, particularly neuropathy. And a truncated course may minimize some of those adverse events. What we don't know and needs to be analyzed moving forward is the outcomes post-transplant in this population. Whether novel therapy results in similar long-term disease-free survival as conventional chemotherapy needs to be ensured so that we establish and maintain curative potential in this population.